Can you please? I'm
Yes,
audible.
yes, you're audible and visible.
Okay. So, good evening and welcome to the SAMSA Meet the Resident Series Edition 2020 Medical College Kolkata as a fresh dermatology resident then. Fast forward 3 years, and our friendship has continued to a second edition of Meet the Resident Series with our discussion today. Meet Dr. Shriya Saha, your newest and coolest dermatologist in town, who has recently graduated from Medical College Kolkata and is currently pursuing her senior residency at RG Kaur Medical College. She is keen on dermatosurgery and is interested in continuing her spiritual practice alongside her medical practice. It's lovely to have you here with us, Dr. Shriya.
Thank you, Meenakshi, and thanks to Samsa for having me here and giving me this opportunity.
So, dermatology, as we know in MBBS, is very little understood, almost a misunderstood field. Dr. Shriya, please tell us what drew you towards the subject and what fascinates you about it.
You rightly said dermatology is a very poorly understood subject for most MBBS students. And so it was for me also when I was doing MBBS. And even during internship, I did not get a chance to choose dermatology as one of my elective postings. So I just watched a few videos of some of the faculties to get an idea. And yeah, so I, having no first-hand experience, I did not really know what a dermatology clinic actually goes like. So that left me only one way to decide my specialty, which was the process of exclusion. So I was confident that I did not want to pursue any of the other subjects like medicine, surgery, gynae-obs, pediatrics, ophthalmology, ENT. So I was very sure that I did not want any of these. Sorry for the disturbance. And I just could not commit to any of those branches provide me everything that I wanted, which was a blend of medicine and surgery, a work-life balance, and also a branch which would allow me to devote time for my spiritual practice also, which has been very important for my life, especially for the past 3 to 4 years. So, in summary, I did not want my field of specialization to consume me, hence, I had only two options left for me, dermatology and radiology, to left to choose from. And but I was sure that I wanted patient interaction that was important for me. So, hence, dermatology seemed like a perfect match.
I think that echoes the thoughts of many students who do want to opt for dermatology because some of us we do want something that we want time aside from our medical practice to pursue other side careers or hobbies or passions. So dermatology just does give a very good flexible lifestyle in that regard. So, dermatology felt like a very small part of the MBBS curriculum, and many feel there's not much to read compared to other branches in post graduation as well. How true is this perception?
Really, MBBS days and even during PG preparation, ऐसे लगता था कि मेडिसिन सर्जरी कितना वास्ट है, इतना और नहीं पढ़ना. एंड डर्मेटोलॉजी की तो कितनी पतली बुक है, तो पीजी सिलेबस भी वैसा ही होगा. But then, going through residency, the syllabus seemed so vast that I wondered how come हमने 6 months में जब हम पीजी के लिए प्रिपेयर कर रहे थे तो हमने 6 months में 19 सब्जेक्ट्स पढ़ लिए एंड नाउ एक सब्जेक्ट फिनिश करने में इतनी मुश्किल हो रही है. So yes, I may not be the that comparison is immaterial.
Definitely, and dermatology may all of us start from zero, and no one has much knowledge. So I'm sure it is quite an uphill task to acquire the skills and the knowledge. Dermatology is considered as a terminal branch of medicine with no DM courses at present. So, does it have subspecialties too?
Dermatology is still considered an end branch. So, if you're not motivated enough to give any more entrance exams like for DM or MCH, you can take up derma. However, there are some super specialization courses coming up in the near future, I think, as far as I've heard. But at present, there are a lot of fellowships available. So even after MD, you can pursue even surgical specialties like hair transplant, like laser, cutaneous oncology. So there are various subspecialties available here also, but then you won't have to give another entrance exam to get into it.
I think that is a big relief that we don't have to give another entrance exam because we know how difficult that phase is in our lives. So, Dr. Shriya, please tell us a day in the life of a dermatology resident.
Yeah. Dermatology residency a day may vary a bit from institution to institution, but basically, you will have daily OPD, and some hospitals even have a separate specialty clinics of leprosy and STI, that is sexually transmitted infections. So, you may have a separate clinic on some days and your visiting physician and perform the workup of the admitted patients. So that's under their guidance only and setup. So depending on the facilities available, you will also get to perform procedures like skin biopsy and other therapeutic procedures also. So you may have regular classes or seminar, journal club, and also bedside presentations if you have a ward. Apart from this discussion of biopsy slides, and of course, you will have ample opportunity for research and publications if you are in a government setup.
That sounds very interesting. And dermatology, as we know, is a very visual field. Like we can see most of the diseases in front of us, which is not the case with many other branches. So, do you think diagnosing is easier in dermatology? And what brings thrill to the field?
You're right. Dermatology is indeed a very visual field. When we see a patient of general medicine or general surgery, when they give out a complaint, we have to, of course, for most of the cases, they have a very straightforward diagnosis. But then there are also lots of conditions which have similar presentation, and even many common skin conditions are there which have rarer manifestations. So, dermatology is all about differential diagnosis. And in many cases where you have confusion between two or three diagnoses, or you have no idea what it is, so in those cases, you have to perform a skin biopsy and correlate with tissue diagnosis. And many a times it happens that you will think of a provisional diagnosis, but the tissue findings will reveal something completely off the spectrum. So, the thrill in dermatology actually lies in diagnosing the case than planning the treatment, which I feel is a bit simpler in dermatology.
So, Dr. Shreya, we have some experience regarding the OPD in dermatology, but there is part of residency life and learning. So, can you please tell us more about the inpatients in the ward experience?
Yes. So, inpatient departments, as you said, it forms a very important part of training because most cases which are admitted are critical patients, like, for example, severe drug reactions or pemphigus or other vesiculobullous diseases, or diseases like SLE, erythroderma. So mostly these are some of the common cases which are you won't be able to follow up the patient institutes, then you can speak to the respective residents and find out about their departments in particular. Does that answer your question, Mayuk?
Yes, ma'am. Thank you, ma'am. Another question is that I have got a great rank in NEET PG, so I want to take dermatology only. But most of the seniors have a negative approach when I say about that that dermatology does not have that much of employment in private sector or in the government sector. You have to open your clinic, and that would invest.
Yeah, what you have said is actually it has two parts. One, I completely agree with that there are. Meenakshi, can you mute, please? Yeah. So, dermatology, there are very few openings in the government setup and in big corporate hospitals as a permanent staff, you know. That is very true what your seniors have said. But then establishing your own private practice does not require much of an investment because, once you're starting, you can just opt to see patients on an OPD basis. You need not start with procedures at once. So, if you're starting out with procedures, you need to have an OT setup that requires investment. But if you're just starting out as an OPD, then you only need a desk, your prescription pad, and a pen. So, that is all you need to actually establish your setup initially. So that is hardly any investment. I don't think any branch would have the scope for such low investment during initial private practice. So I think you need not worry about the scope in future because there is not a single dermatologist I have come across who is not earning as per his or her satisfaction level, and there are no unemployed dermatologists as well. So do not worry about that. If you really like the subject, then you should take it because if you take something which you're not passionate about, you do not like, then that will stay for the rest of your life. So do not make a mistake there. If you like something, you should take it.
Thank you, ma'am.
Ma'am, I think we have a question from Dr. Achyut. He's asked, how did Dr. Shriya balance her clinical commitments and research commitments during her 3 years? And is there any points to ponder with regards the same?
Okay, so actually, balance in dermatology is pretty easy to achieve because you do not have many commitments in your day. So I got back by 4 to 4:30 p.m. And so I had the rest of the day to my own. So that gave me ample time to pursue academic work or even other hobbies which I was interested in. So balance is really not an issue in dermatology.
Any other questions from the audience or on YouTube? If Shita could tell us, please.
Okay, so regarding emergencies, you do not have many emergencies, like not as frequent as general medicine or general surgery or even obs gynae. But you do have some emergencies like severe drug reactions or other patients which are admitted in the ward. If they are critical, then you may be given a call to visit the wards. But usually, on call is not that problematic in dermatology. So, like in our hospital, most of the on call work was done by the first years and to some extent second year residents. Usually, if the patients are admitted, any patient gets critical, then the nurses would call you and you have to go and take a look. Otherwise, you have a easy like you do not have to wake up nights like in medicine or surgery. So and and especially this is during residency when you will have certain emergencies which are admitted in your ward. But after residency, if you are in a private setup, you're practicing on your own, then the amount of emergencies is negligible because mostly these cases need to be managed in a hospital setup. So there's not much you can do in your clinic. So you have to refer them to a government setup or a private hospital where they can be managed better. So that's about it.
Are we taking any other questions? Ipshita, if you have any.
Uh, are there any short courses in dermatology available? And if there are any, are they any significant?
Sorry, your audio was not clear. Can someone else repeat, or can you put your question in the chat box?
Are there any short courses in dermatology available? If there are any, are they significant enough, adding to your knowledge and experience?
Uh, Meenakshi, did you catch the question?
Yes, I think the question was, are there any short courses in dermatology available, and do they help in adding to your knowledge and experience? I think besides MD, ma'am wants to know if there's anything else somebody else could do.
Yes, that's right. Besides the
Okay.
MD or diploma or
Uh, Okay, so if you are asking about the primary degree with diploma versus MD, so diploma is a 2 year course, so it is relatively shorter than MD, but it has a few drawbacks. Like you cannot join a government setup as a faculty if you're only um, having diploma degree. So that is one drawback. Otherwise, with regard to learning, I think it's equivalent. What you learn in 2 years, you can. It does not affect much what you learn in 3 years. So that's there. If you do not have an option of choosing MD, so then, but you really want dermatology, then you can go for diploma, or you can also consider DNB because the syllabus and the like teachings it's almost the same. There's no difference with regard to that. And regarding other courses after MD, so there are no DM courses at present, but there are a lot of fellowships offered in different branches like dermatopathology or trichology, hair transplant, cosmetology, pediatric dermatology. So, like that, there are a number of subspecialties developing now. And if you're interested in a particular stream, you can pursue that course after MD also. So, many institutes offer 1 year fellowships or 6 months fellowship or observerships. So, you can look into those after MD. Does that answer your question, or did I miss out something, Sarita?
uh, okay. Anything apart from MD, diploma, and DND? Are there any other short courses? That was the question.
Okay.
Right.
I'm not aware of any other formal courses in
Okay.
dermatology apart from these.
Okay.
But
Okay.
the fellowships I'm talking about, so like if you are having a degree in surgery, so you may be eligible to pursue dermatosurgery or plastic surgery, which is also a very closely knit branch with dermatosurgery now. So if you are in some other specialization, then you have to look whether you are eligible for those fellowships or not. Or even after MBBS, I've seen people pursue fellowships in trichology or hair transplant. So you can find out because different institutes have different eligibility criteria. So you can find out about it.
Okay. Thank you.
Thank you.
Do we have more questions on YouTube or here? Anyone wants to ask anything? Okay, I have a question. Can you please tell us something about the international opportunities available for dermatology residents and after residency once we complete dermatology? Like we have MRCP in for physicians in medicine and MRCS for surgeons. And likewise, if there's something we can do in dermatology as well.
Yes, so MRCP can also be done by a dermatologist. You can pursue that after MD. So it's basically just a qualifying exam. It's not a course per se. So you have to get the qualifying marks and you can get the degree. And apart from this, even during residency, there are a lot of scholarships available for